Hello everyone, welcome back. I'm Sornambiga, Assistant Professor at SNS College of Nursing. Today let's talk about the disease that 100% preventable yet still claims tens of and thousands of lives each year. It is a rabies and fetal viral infection that affects and brain and nervous system. Then it is a virus is called rabies virus. In this video, we'll explore what is rabies and how it spread, what happened to the body, how to recognize it, and mostly important, how to prevent it. Rabies is a viral infection caused by the rabies virus that passed of Lissa viruses. It primarily affects the warm-blooded mammals and including humans. The virus is present in saliva of the infected animals and it transmitted mostly through bites. Once the symptoms appear, rabies is the most always fatal, which is early actions it's so critical. After the bite, the virus does not enter into the human blood. Instead of that enters nearby peripheral nerves, it begins a slow, deadly disease towards the brain. During this time, what is the most symptoms? And this virus, there is no symptoms. It is an incubation period, which can last from that few weeks and few months. But it is dangerous. And it's once symptoms begin, there is no cure for these viruses. Then the rabies virus replicate into the human body nerve systems that is called nerve cells. It used to the body own nerve path and particularly that axons to reach the spinal cord and the brain. Unlike many viruses, rabies avoid detection by the human immune systems until it's too late. Once it reaches the brain, it causes encephalitis or swelling of the brain. Rabies is a rare and developed contains vaccinations and control of that animals to stray animals. And but globally it's a major public health issues. Over 59,000 of people dies from the rabies each year. Most probably its case reported in Australia and Africa, Asian countries. Around 90%, 95% of human rabies death from the occur due to the bite of infected dogs. Now, the rabies virus directly attack the central nervous system, including the brain and spinal cords. Early the systems of that non-specific, like fever, tiredness, and some major and minor symptoms are that applicable. But that infected process, severe neurological symptoms begin. What are the neurological symptoms? It's nothing but confusion, aggression, fear of water, and hallucination and seizures. This is the first clinical stage. It lasts 2 to 20 days. And people may experience fever, tingling or itching of the bite side, headache, fatigues, and anxiety or irritability. These are the symptoms. These symptoms may not be seen serious but signal that the virus reacted to the nervous system. Here the sometimes the symptoms will escalate that rapidly. The virus causes brain inflammation leading to that confusion, aggression, muscle spasms, excess of salivas, hydrophobia. That hydrophobia is nothing but a fear of water, and aerophobia, that is fear of the air movements. It is the terrifying that witness. The patient maybe tries to avoid even taking the water, extremely thirsty also. Then the furious rabies that seems 80% of cases the symptoms including the hyperactivity, agitations, hallucinations, hydrophobia is also there. And the paralytic rabies, it is the slowly onset that often means that causes of weakness, paralysis, evenly that coma stages also they can be able to reach. But the type of leads death. Usually it's within the 10 to 10 days the symptoms onset. Now, the trap is spread through the saliva and the infected animals. Mainly through the bites, it can also spread the throat and the scratches, licking of that open wound, narrowly that organ transplantation. Dogs are the main source of that countries, but bats, fox, and raccoons also that can be able to carry that viruses. Rabies treated here the diagnosis and before the symptoms appear, once the clinical symptoms develop. What are the clinical symptoms develop after that? Doctors may test saliva, spinal cord, skin samples, blood, and the diagnosis usually based on the clinical signs. There is no cure after the symptoms begin, but the post-exposure prophylaxis can prevent the rabies by the given early. Then immediately washing the wounds in the soap or water and 15 minutes. Anti-rabies vaccine is the 4 doses over 15 days. And rabies immunoglobulin is the best injected for that vaccine before, and vaccines are generally safe, and common side effects are that mild fever, headache, serious allergic reactions, and how they are that overweight and risk. And we are cross over that wash our hands immediately by the way of soap water, applying antibiotics like iodine and alcohol. Do not wait for the symptoms and consult a doctor immediately. Follow the complete vaccination schedule if the animal known is the health official to that observations. Then the rabies is the few days and few disease and almost 100% the fatality. In that blood test, we can able to identify easily and 100% preventable. Then awareness and responsible of the pet owners to the timely treatment is the save our human's life. And what are the 5 T tests over there? And the T test of the rabies. We are moving on to that. What are the 5 Ts? Although the case of the reported through the world, 95% of cases are the seen in Africa and Asia. And India also continue have the highest rates of the rabies in the world. Once it that infected the virus, will travel and to center of the nervous system, and then the subsequently replicate in the brain causes the acute encephalitis. Sadly, the once a person's symptoms of the rabies, the disease of fatal, it is that important to point travel in awareness. What is the second T? That is a transmission route. The dogs are the most common reservoir of the virus. However, all the mammals should also consider as the potential risk. The virus is transmitted in the way of saliva of the infected animals. This can be through the bite and scratch, even the lick over the open wound or mucosal surfaces. The virus will travel through the body in the central nervous system and system in the brain. Once that fetal encephalitis will occur 2 to 3 months but can be little few of the long. What is the third T? It is a treatment and prevention. Once a symptomatic with the rabies, there is no treatment and the disease, and exposure by the post-exposure time the common recognitions. A travel has been ordered pre-exposure vaccines and rabies immunoglobulin in the blood product therefore carries the risk of blood-borne diseases, and immunoglobulin may very difficult to obtain the require major of travel major cities and countries. And the causes of the rabies vaccines before the travel, sensible and option offer production nearly 100% of the vaccinations, and pre-exposure for the three doses, the timing of the found to respective countries, immunization guidelines, and we have to follow the primary courses of rabies vaccines and advisors will receive the further doses of the vaccine and exposure to that. If someone is scratched and bitten and licked by that animals, that wash with a wound, soap water or soaps immediately. Apply other alcohol or antiseptic in that wound cover and simple dressings. Seek that immediate attention of the patient, and we can able to recover the patient by the way of immediate protocol materials by the way of consulting your doctor. What is the third T? The traveler risk. The main risk of the traveler related to the location they are going to activate there. They will be to that and increasing their likelihood being exposed the higher risk of activity including running nose, cycling, traveling and the remote areas like at wherever that significant amount of time getting back to that suitable medical facility. And small children must be careful to watch with the playing with the uh, dogs and animals. They can attract with that furry animals, and then they will also be people for traveling and volunteer purposes. What is the fifth T? Take home for that message. Rabies is a viral disease and that fatal. It can be transmitted by bite, scratch, even a lick. There is no transmitted that one symptoms is present. However, that post-exposure treatment option is the access urgently. That pre-exposure vaccination should be highly effective at preventing that rabies and should be considered. Anyone exposed should be remember wash your hands with the wound or soap or running water several minutes. Applying alcohol or antiseptic and wound cover in the simple dressings, and seek that immediate attention for that medical care. And moving on to the end of the part. That moving on to the end of the part, I hope this video will understand for your study and practical purpose. Stay safe in your home.